Even the smallest idea can spark big change. At HIROC, we see it every day, with organizations across Canada finding new ways to create the safest healthcare system. On Share, Scale, Repeat, we talk through some complex topics in healthcare, interviewing the brains behind the projects that are keeping Canadians safe. We're doing this so you can find ways to scale the information where you work, because safety can't happen in silos.
Hi everyone, it's Abby. Thanks for joining us on another episode of Share, Scale, Repeat. I'm here with my co-host Trevor Hall. On this episode, we sit down with Yukon Hospitals' Lindsey Page, Manager of Quality Improvement and Risk Management, Keith Welch, Occupational Health Nurse and Infection Control Practitioner, and Lisa De Panfilis, Director of Quality, Safety, and Strategy. Trevor, do you want to share a bit about what we talk about?
Absolutely. Thanks, Abby. We chatted about Yukon Hospitals' N95 respiratory project and their critical incident stress management project. Lindsey, Keith, and Lisa's unique expertise and perspectives coming together made the conversation that much more interesting. Abby and I learned so much about the impact of the projects, and we took away great advice on filling gaps in safety and even pivoting the direction of a project. Let's get to the episode. Happy listening.
Hi, Lindsey, Keith, and Lisa. Thanks so much for joining us on our Share, Scale, Repeat podcast. We'll get to the amazing projects you're working on, but first, tell us about yourselves.
I'll start. My name is Keith Welch. I've been an RN for about 20 years now. I've been living in the Yukon for 16 years now, and I work as an occupational health nurse and infection control practitioner.
I'm Lindsey Page. I'm the Manager of Quality Improvement and Risk Management, and I've been with the Yukon Hospital Corporation for almost 19 years now, and I've played a variety of roles, and I'm really happy to be here today.
Hi, my name is Lisa De Panfilis. I'm the Director of Quality Safety Strategy at Yukon Hospitals. I'm just coming up on 2 years working in the Yukon, and I have the pleasure of supporting Lindsey and Keith in this amazing work, and I'm a nurse by trade. Thanks for having us.
And thanks for joining us. And now that we know a bit about you all, shifting gears a bit, tell us about the N95 respiratory testing project.
So the N95 Fit Testing is a crucial component to a respiratory program. N95 testing evaluates the seal between a respirator and a person's face, identifying gaps or leaks that put workers essentially at risk. Fit testing results confirm if a mask will provide the right level of on-the-job protection for workers. What we love about having a quantitative fit testing machine is that it gives an objective and numeric measurement of an N95 mask fit.
From a practical perspective, too, up here in the north in Whitehorse, Yukon, tuberculosis is still quite a prominent condition that we deal with on the daily. And so an N95 mask fit machine really is essential in supporting our staff to avoid any avoidable exposure to such a preventable disease.
So at the Yukon Hospital Corporation, we conduct fit testing for employees, including clinical staff, privileged physicians, and those who may be present during aerosol-generating procedures, may encounter a patient on airborne isolation precautions, or have contact with a patient undergoing an aerosol-generating medical procedure on dropout precautions. So we also provide testing for non-clinical staff, so building technicians, electricians, maintenance engineers, First Nations Health Program staff, laboratory staff, pharmacy staff.
And the background on what this project is all about is so important. But now take us to before the project even began. When did you realize a gap in care that a new quantitative fit testing machine could fill?
In 2023, Yukon Hospital Corporation only had one fit testing machine that was used to provide mask fittings for all 3 hospitals. One mask fitting machine was housed at Whitehorse General Hospital, and our occupational health and safety consultant and our occupational health nurse, infection prevention and control, so Keith's job, traveled to the community hospitals with the machine to provide staff with mask fittings several times a year. And we knew if our one machine was off-site, no other employees could be fitted, and staff couldn't essentially work in these high-risk situations and areas. So we knew we had to do something.
COVID certainly did teach us the importance of these N95 fit testing machines and the process that we do fit them. We had to learn to be very efficient. And a lot of the staff also learned to appreciate the importance of protecting themselves from diseases that can be aerosolized and or tuberculosis, which are inherently so. And so over the years from COVID on, we became quite intimately connected with our mask fitting machines. And then the idea, as we learned that this machine we had was now reaching the end of its life cycle, really kind of put us under the gun. We have a lot of rotating staff, a lot of new staff who come through, and they're all seeking mask fits to ensure they ourselves are protected. So learning that our mask fit machine was nearing the end of its life cycle, we got quite nervous. And to be honest, for a while, we did not know how we were going to be able to update the system. We are, like most hospitals, we are pretty strapped for cash and have to be very fiscally responsible. So between fitting all the staff we have here and all the staff in the community hospitals, we very quickly realized we had a problem.
So with the help of HIROC and the safety grant, we were able to procure a new N95 Quantitative Fit Testing Machine. So we were able to repurpose our original machine to a community hospital. So they have built some internal capacity to provide fit testings right in the hospital.
We were also able to then use the older machine to support mask fittings in the communities. There are a lot of staff who come through and don't necessarily spend a lot of time in Whitehorse. They go when we have community hospitals in Dawson City and Watson Lake. And to be able to support mask fittings in those communities was a key component as well.
And I'm wondering why this was an important safety issue for your organization to tackle.
Well, as mentioned, tuberculosis really is a pertinent issue. Both we get a lot of patients who have suspicion of tuberculosis and or confirmed when there's initial triage period and we're trying to figure out whatever respiratory conditions someone might present to the hospital with. Tuberculosis is on our mind and on the active differential until we can prove otherwise. So when someone is at risk of having tuberculosis, the way we protect ourselves is to wear an N95 mask. And again, COVID is still very prevalent and it is very easily aerosolized. So again, until we can rule COVID out, it is important that our staff have fitted N95 masks. We also often get patients when they are confirmed with tuberculosis and they require treatment. They can be hospitalized for months at a time. So all staff, when interacting with them and going into the room, need to have a fitted N95 mask. I would also offer particular critical importance. We're quite proud of our First Nations liaison program and our workers up here. And so we often have a disproportionate representation of First Nations patients with tuberculosis. To be able to support our First Nations staff to visit with this patient, spend extended amounts of time with them, ensuring that they have a fitted N95 mask is absolutely essential.
Yeah, this is an extremely fantastic applied project. Really speaks to how building trust is critical, but also the amazing pieces around communicable disease prevention and public health promotion. We know lots of staff members from across the organization positively impacted the success of this project. Can you explain why this project's impact is so far-reaching?
Well, I mean, it really, again, I apologize if I'm repeating myself, but the prevalence of the diseases that require protection with the use of this N95 mask is, I mean, as Lindsey mentioned, there's very few areas of the hospital where they would not be involved in requiring the protection that an N95 mask offers. So I think during COVID, we found ourselves fitting nearly 500 to 600 people a year. And as that was one, maybe two people's responsibility, having a mask machine that fits appropriately is beyond important. I would even take one more step, is there are other methods for mask fitting. This quantitative method really provides a lot of security in the quality of the fit. And so having a machine that was reliable, expedient, I shudder to think what we would have done without it. It's not just any machine, but the new one in particular.
Yeah, absolutely right. I think, like, especially when you're at geographically distant areas, and making sure that we have that reach. This is fantastic. What advice would you give to others in healthcare who notice a gap that needs to be filled, but don't exactly know what to do next?
I mean, there are resources out there. I mean, I think different areas of the hospital. I mean, operations. I mean, I often feel like the mechanic over an engine who puts his hand back asking for the right tools, so having other people within the hospital and the facility who know how to ask for these tools and get these resources is beyond important. And that's something certainly Lindsey and Lisa have been very good at and very supportive with.
Super neat. I think I like your analogy of the mechanic over the engine, right? And what's in your toolbox at what moment, and if you're missing a tool, how do you approach that, and how do you have those conversations to move together in that direction? Again, very important public health initiative, absolutely critical to building trust within the community, and also just maintaining safety. So keeping people healthy and within the community and at a hospital. Part of our earlier conversations, you mentioned that we chatted before on and about critical incident stress management, a project that you undertook that really that took a pivot based on the staff needs. I'm wondering if you might be able to share a little bit about that, about the pivot, about the transition, and more so about the work that you've done around the critical incident stress management program.
Thank you. Yeah, at the time of our initial CISM project submission, we believed we had a very clear understanding of the organization's needs. However, through subsequent engagement with staff, community partners, and clinical professionals, it became very evident that our original assumptions required reconsideration. Yeah,
the initial program, with this money, we really got excited. I mean, this is quite a passion project for us too, the idea of being able to support our frontline staff. And so trying to figure out how to do so best was something we got very excited about when given the opportunity with the funds from HIROC. And so initially we had thought we were kind of grabbing on a train-the-trainer methodology, which we thought would be the most cost efficient and a way to get enough people engaged in more modern, perhaps progressive mental health awareness and supports. But we did some environmental scanning and started looking around. We realized the problem was much larger than that. We really needed a far more systematic and comprehensive approach that a train-the-trainer methodology wouldn't be able to support. And so we also when looking around, we did find our local EMS group had developed a bit of a CISM program. And so looking at some of their successes, failures, and some of their programs, we realized that if we genuinely wanted to help people, as opposed to simply ticking a box that's saying we're offered support, if we really, really wanted to start changing culture and offering our incredibly hardworking frontline staff the support that they deserve, that we needed to do something far more comprehensive.
I really like what you're saying is the emphasis on really wanting to help, and how do you create that cultural change. There's something that someone very special to me used to say was, hey, the proof of the pudding is in the eating. And what you're saying really resonates with me is that, hey, there's check boxes, there's tokenism, there's other pieces in which we are able to say that we're achieving something, but really to eat that pudding, or to create that action, really takes an approach of dedication and energy to bring that through. No better place to put that into than critical incident stress management, right? So we know the impacts of this, and the benefits in which we can see. I love what you were mentioning around the need, and as you were learning more, vastness in which you approached it. I'm wondering along those lines, do you have any advice for our listeners when it comes to making a tough but needed decision to pivot in terms of direction of a project?
I think the process has demonstrated the value of remaining adaptable, being willing to reassess and pivot approaches, and just sometimes you discover along the way what you thought you needed wasn't necessarily the case. And
I think being a nurse for as long as I have, and again, with the support of the management, Lisa and Lindsey, who have been here quite a while and have their own varied experiences, I think it became quite clear that the level of support we wanted to offer, and that was the gap we were looking to fill, was such a genuine one and an important one. And I think when we're genuinely trying to look after our staff, I think you trust your judgment and where you want to go, and then you trust the vision of the support that they deserve. I think when you are honest with that, I think you can really see where your efforts need to go. And again, the trick after that is having the support of your management and directors to move in that direction. So again, as someone who generally focuses on operations, to have the trust of my direct reports to hear that, no, we do need more and that our initial plans are incorrect and we do need to invest a lot more time and energy into where we want this to go. I mean, that requires a lot of trust within each other. And so having our effective team is a big piece. But then also really trusting our gut and knowing our frontline staff and knowing the pressures that they do face. I think when you trust yourself and, again, you have an effective team that supports each other, I think you can reach for something that is authentically good. And but that does take increased effort and, again, a lot of trust and teamwork.
Yeah, I think you've nailed it, in my opinion, in many folds. I think that we've heard about a true commitment to being and remaining adaptive, to having those committed conversations to come back and say, hey, this is what it is, this is what it's not, and where can we move from there. I think that you continue in this these great examples share around the power of trust, of true collaboration, and really working hard to see improvement. Wishing is not enough, right? Wishing is not a strategy, but moving forward in a kind and purposeful fashion allows us to make change. I think really what I've heard as we just kind of close out these great projects is one, you're operating, your environment, you're operating in a very unique geographical as well as amazing area of Canada, the applications within the north. You're balancing resources, you're building upon community and wise practice and knowledge. And what I take away from each of you, which is really super exciting, is this true joy and lots of energy. And I think this is where bringing these lessons today through the Share, Scale, and Repeat podcast really allow us to think about, hey, are we doing what we are intending to do within a project? When we're not, how do we ensure that we're able to pivot and iterate in a way that meets those needs in a very authentic way? Before we close out this, Lindsey, Keith, and Lisa, any final thoughts on the great work that you've been able to achieve?
Yeah, I just want to highlight a few concepts about some of the pieces that Lindsey and Keith talked about. And Trevor, I think you really highlighted the core of this. Again, with both of our projects has been about supporting staff safety and well-being at the core of that. And really grateful for the support we've gotten from HIROC and from our team internally to move this forward. We often talk about as a team how being in the business of healthcare, helping people stay well, is really how we can help deliver our mission of safe, high quality care. And, we know that working in healthcare is becoming increasingly challenging and more complex. So how can we enable staff to do the good work that they do and stay safe in doing that? With the critical incident stress management work, I personally feel that this is really close to my heart. Working as a frontline nurse and working in mental health and psychiatry, I have had peers be there to support me in managing and responding to some very difficult and emotional situations. And that did make all the difference for me in moving through that and focusing on, what learnings will I gain from that situation moving forward, and how does it help me develop in my practice? So I think that is an important part of this work, and it really is heart work, and it also impacts culture. Thinking about our safety culture, how can we openly talk about challenges that we're dealing with when we respond to a critical incident, acknowledging that at times we can have second victim syndrome or stigmatizing attitudes about how we're coping. And all this work is focused on, breaking the silence on this and moving the needle on staff well-being and retention at our organization through our projects. So we're really, really hopeful and excited to move forward on developing and growing this, and really appreciative of the support and learnings we've taken, not only from HIROC, but from other partners across Canada that we've reached out to. We've learned a lot, and are really appreciative to share some of those learnings today.
Well said. I know you can't tell from a podcast, but I'm all smiles here. I think a few pieces that bring me joy and happiness is, hey, hard work is hard. You highlighted the motivation, and Keith and Lindsey have also shared around together doing this for the betterment of the collective good. There's also this real piece that I've taken away from what you just mentioned to Lisa. And amplified by Keith and Lindsey earlier is believing in good. A lot of times, as we think about sharing and scaling and repeating great work, it largely it takes starting with us and moving outside from there. And that's that believing that there is good and that you're able to achieve. And by doing it in a very thoughtful, energized fashion, I think that action is just so wonderful. I think it fits extremely well to our Share, Scale, and Repeat podcast, where really it's about understanding, it's about discovery, it's about trying to talk about things that we don't always talk about. Lisa, you've put it really, really perfectly in my mind. Again, is together breaking that silence and ensuring that we are building a safe, trustworthy space to be able to continue to provide the best care and the safest healthcare systems together. I want to, on behalf of Abby and all of HIROC, a very, very heartfelt, all smile thanks for being our frontline. Thank you for being part of the Share, Scale, and Repeat podcast today to talk about these great initiatives, but also highlighting where there has been decision points to change and to pivot in real time to ensure that the adaptability and the authenticity of these projects is in. So a huge thanks again from all of us. And we'll look forward to seeing this great work. And again, thank you to all of our listeners for, again, sharing and scaling and repeating this great work. Thank you.
Thanks for listening. For more interviews, be sure to follow our show wherever you get your podcasts. If you like what you hear, please rate and review the show. If healthcare innovation is your thing, check out HIROC's award-winning leadership podcast, Healthcare Changemakers. And don't forget to follow us on LinkedIn to see the latest news in risks, safety, insurance, and more. Share, Scale, Repeat is recorded by HIROC's Communications and Marketing team and produced by Podfly Productions. Have a question? Email us at communications@hiroc.com. Until next time.